Hello, my name is Julianna West. I am a third-year medical student at McGovern Medical School in Houston, Texas. This project was created in collaboration with the Emergency Medicine Research Department at McGovern. Today, I will be discussing emergency department visits associated with hemodialysis by uninsured patients in Texas. I have no disclosures to report. Patients with kidney failure or end-stage renal disease require chronic outpatient hemodialysis treatment. Those patients with insurance may receive scheduled outpatient hemodialysis at dialysis centers. However, for uninsured patients with ESRD, hemodialysis may only be available through the emergency department. So, our objective was to characterize emergency department visits associated with hemodialysis by uninsured patients in the state of Texas. We performed a cross-sectional analysis using the Texas Emergency Department dataset. This dataset is collected by the Department of State Health Services from hospitals throughout Texas. It contains information on patient demographics, diagnosis and procedure codes, and associated charges. We chose the state of Texas as our population because prior studies characterizing uninsured hemodialysis patients were limited to small regions in Texas, and thus we wanted to broaden the discussion to a statewide analysis. This is a flowchart describing our analysis. We included all adult ED visits with a length of stay less than or equal to 1 day. We then identified hemodialysis treatment using CPT and ICD-10 procedure codes. Insurance status included insured and uninsured. In total, there were 33,829 ED visits associated with HD. 10,390 were uninsured, with an incidence of 1.24 per 1,000 adult ED visits. There were 23,439 insured visits for HD. Uninsured HD patients, compared to insured, were more likely to be younger, age less than 45, white race, and of Hispanic ethnicity. Most uninsured HD originated from the Arlington and Houston regions of Texas. To calculate the associated costs of emergency department hemodialysis treatments, we used hospital cost-to-charge ratios to convert the charges in the dataset to actual costs. The cost-to-charge ratios were provided by the DSHS of Texas from the Agency for Healthcare Research and Quality as a partner in the Healthcare Cost and Utilization Project. The mean cost per patient was $2,101.74 for uninsured HD and $3,238.70 for the insured. Overall, hospital costs totaled $75.9 million for insured and $21.8 million for uninsured ED-HD visits. In comparison, a visit to the emergency department for hemodialysis treatment costs approximately $2,000, as opposed to $250 for a scheduled outpatient session. In conclusion, there were 10,390 ED visits for hemodialysis by uninsured patients in 2017. These results are the largest estimates of the statewide burden of uninsured HD, with associated hospital costs totaling over $21 million. Policymakers and clinicians might use this information to address the healthcare burden of the uninsured HD population. These are my references. Thank you.